Assalamu alaikum guys, welcome back after a long time. Today I'm going to discuss about optic neuritis, its classification, causes, symptoms, signs and symptoms, and how to treat the patient. Optic neuritis is defined as the inflammation of the optic nerve. It is the second cranial nerve. Now the patient will come to your OPD with the chief complaints of sudden painful decrease in vision, and along with that he will have difficulty in differentiating between the different colors. So first of all you check the vision. Now it can be 660, 636, or it can be in counting fingers. It depends on the severity of the disease. So there are six things you need to see in a patient of optic neuritis that presents to your OPD that can strengthen your diagnosis. First of all is visual acuity. Then you need to check for relative afferent pupillary defect. Then color vision, contrast sensitivity, brightness, and visual fields. These six things you need to see because they will be affected in such patient. And of course he will have sudden decrease in vision along with painful eye movement and uniocular. It is mostly uniocular. The visual field defects in a patient of optic neuritis is usually diffuse central 30 degrees is affected. It can be also central cecal and altitudinal, but most commonly the central scotomas involving 30 degrees is usually the most common presentation of such patients. Now let's come to the classification. Okay, so usually it is there are three presentation of optic neuritis. It can be retrobulbar, it can be papillitis, it can be neuroretinitis. Now retrobulbar means that when you check the fundus of such patient, you will see a normal optic disc because the inflammation that is occurring is behind the optic disc. So usually the patient will come to you and you won't see anything on the fundus examination, but you need to have a strong history, you need to have a good history, then you can strengthen your you can go with your provisional diagnosis. And remember, this is the most common cause of optic neuritis, the retrobulbar, which is 70%, and it is in adults, and the usual it is associated with multiple sclerosis. The second one is papillitis, which is usually common in children, and in this one you will see a hyperemic disc with flame shaped hemorrhages around the disc. So if this patient comes along with the history, you can easily diagnose it. The third one is neuroretinitis. Now in neuroretinitis, there is inflammation of the retinal nerve fiber layer, the optic disc, and there is a macular star. In the macula, you will see such exudates in a star shaped pattern, which is called a macular star. Now this is the least common presentation of optic neuritis. Now, one important investigation you should do in such patients of demyelinating optic neuritis, or you can do it all of the patients since you don't know the cause, but like I said, it is the most common one. You should do MRI brain. Since in majority 70% of the patients I said it is demyelinating disorder and that is retrobulbar. So you have to do MRI brain to find where is the pathology, and in MRI brain you will see such demyelinating areas in the optic nerve which will tell you that it is optic neuritis. MRI brain is very important. You should do in all patients. Whether or not you are suspecting any infectious or any other cause, you should do it because, like I said, multiple sclerosis has a strong association with optic neuritis. So always do MRI brain. So if we come to the classification of optic neuritis based on the etiology, we can define it as demyelinating, in which the multiple sclerosis is the most common, parainfectious, in which there can be viral or autoimmune diseases, infectious, in which there can be cat scratch disease, syphilis, Lyme disease, and so on. And the fourth one is non-infectious, which includes sarcoidosis and systemic autoimmune diseases such as systemic lupus erythematosus, polyarthritis nodosa. So now you need to find the factor, the cause of optic neuritis. Now usually, as I said, the patient is the most common one is the demyelinating one. So when such patients come to our clinic, we start them on IV methylprednisolone. Now the dose is IV methylprednisolone 1 gram OD. That means you need to give 1 gram per day for 3 days, followed by oral prednisolone that comes by the name of delta cotrell, which are 5 mg tablets, and you need to give it by the dose of 1 mg per kg. So let's say if a person is 80 kgs, so you have to give 80 kg per day. So you can divide it into, since one tablet is 5 mg, you can divide it into 4 plus 4 plus 4 plus 4. Now this dose will continue for a period of 11 days, followed by tapering over the next 3 days. Let's say 4 plus 4 plus 4 plus 4, then you go with 3 plus 3 plus 3 plus 3, then 2 plus 2 plus 2 plus 2, and 1 plus 1 plus 1 plus 1. So this is the standard regimen of this demyelinating optic neuritis. Now if the cause is infectious, like I said, it can be cat scratch disease, Lyme disease, syphilis, then you have to treat the cause, and that will result in the resolution of optic neuritis. And remember, optic neuritis develops over usually 2 weeks to 3 weeks, and but the visual prognosis is good. They usually recover to about 6 9 or even better, and in about 2 to 3 weeks, and the rest of the visual acuity, it gradually recovers over a period of 6 months to 1 year. So you have to check visual acuity of the patient. You need to check the color test, color, with the Ishihara test. That also usually takes time. You need to check his visual fields. You need to check color brightness, all the 6 parameters which I mentioned at the start of this video. If you pick the patient at the time, you can save the patient's eye. So remember, timely diagnosis, detection, and starting the treatment is very important. If there are any questions, please feel free to ask in the comment box. Until my next video, guys, take care.